Now to the coronavirus pandemic. 2/3 of adults in the U.S. are now fully vaccinated against the virus. This comes as the nation's booster rollout is now underway. Nearly 2.8 million people in the U.S. have already gotten a third dose, including President Biden. Errol Barnett reports from New York.
Americans are lining up to get the Pfizer booster shot after the CDC cleared the way on Friday for millions of those at high risk to get a third dose. Some 340,000 have been administered since then, including to those who are immunocompromised. Even the president rolled up his sleeve today, and while receiving his third dose, addressed the nearly quarter of eligible Americans who have yet to get their first.
Boosters are important. But the most important thing we need to do is get more people vaccinated.
This as thousands of New York hospital workers face an ultimatum: get vaccinated or be terminated.
It's not a role I relish, but I also am realistic to know that there are people who will not come back to their jobs.
New York's governor is considering calling in the National Guard to help fill positions. While 84% of state hospital workers are now fully vaccinated, that means more than 83,000 are not.
You're really ready to give that up. You're really ready to give up your paycheck. A lot of people at that point say, okay, wait, I'll go get vaccinated.
That's already happened at New York Presbyterian Hospital, which implemented its mandate last week.
You don't want to shame anybody. Certainly no one wants to lose a job, and we didn't want anybody to lose their job. But we felt that that had to be the choice that people would make.
New York is now one of at least 6 states, plus the District of Columbia, that have vaccine mandates in place for healthcare workers. No mandate! Despite some protests nationwide. Do you feel then it takes a mandate to get everybody vaccinated?
We felt that unless we had a mandate, we would not get to where we needed to get to as an institution, to protect our patients, to protect our staff, and each other.
And here's the proof. Dr. Corwin also tells CBS News some 30% of his staff were unvaccinated over the summer, and there was a real rush to get the shot right before the deadline. Tonight, Ed, the unvaccinated numbers here are below 1%.
Our Errol Barnett here in the Big Apple. Thank you. We're joined now by Dr. Ben Weston. He's an associate professor in the Department of Emergency Medicine at the Medical College of Wisconsin. Doctor, thank you so much for being with us. As we just saw, New York hospitals are now bracing for possible staff shortages as a vaccine mandate goes into effect. Do you believe these requirements are the answer to the vaccination gap?
Well, thank you for having me. I think these are critical requirements. You know, we all have reasons that we ourselves get vaccinated to protect ourselves, to protect our family. But I'll tell you, I work in an emergency department, and for healthcare workers, we have an added responsibility, and that's to our patients. Every day, healthcare workers are interacting with people who are immunocompromised, people with, they're interacting with sick children who can't yet receive the vaccine. They're interacting with the frail and the elderly. And these folks need to feel safe. They need to be safe in their healthcare environment. So I think these are critical mandates.
It's kind of like, you know, you're the president of the Hair Club for Men. You're not only the president, you're also a client. By being a medical professional who takes the shot, you're proving to your patients, you know, I trust it and it works, right?
I like that example. It sounds right.
Yeah. So the president today received his coronavirus booster shot, but as we heard, he also stressed the importance of initial vaccination, saying those who haven't gotten it yet are, quote, causing an awful lot of damage. If this is a pandemic of the unvaccinated, as so many experts insist now, how much of an impact does everybody else getting a booster really have at this point?
Well, I don't think boosters are going to be what ends the pandemic. I mean, there's no doubt there. Boosters are important for the people who are getting them, for the people who are older, for the people who are immunocompromised, for the people who are at high risk because of their medical conditions or because of their exposure. But without a doubt, our priority, our efforts, our resources need to continue to go toward people who have not yet gotten vaccinated. That is going to be the key to ending the pandemic.
You know, as a parent of 2 young kids, I continue to watch for the vaccination for young kids news. Pfizer says it's submitting data for kids under 12 to the FDA soon, adding it's a question of days, not weeks. Do we have a sense of what federal officials will be looking for when deciding whether or not to authorize the pediatric vaccine?
Well, I agree with what you're saying. We're anxiously awaiting it. And based on the news we're hearing, I think potentially this week we'll see the data submitted. And at that point, we'll get to review the data ourselves. It'll be much more available than it's been in the past. And I think there's 2 things we need to look for. One is efficacy. Does the vaccine work well? Does it have a strong immune response to protect kids from COVID? And number 2, of course, is safety. And from what we've seen in adults, from what we've seen in young adults, from what we've seen in teenagers, there's every reason to expect that these vaccines are going to be incredibly safe. This vaccine that's been developed is one of the safest vaccines that's ever been developed. It's one of the most effective vaccines that have been developed. And I think we're going to see that in young children as well in the coming weeks.
When you say, just to clarify, when you say we, does that mean that it's open source and a doctor like yourself can look at this as well when they submit it to the FDA?
So right now what we've gotten from Pfizer is basically information saying it's very safe, it's very effective. And that's about it. Now, what'll be helpful is I think once they submit it to the FDA, that data, I believe, I hope certainly, will become more widely available so that it can be reviewed by other academics, by other physicians, by parents, and understand exactly what's going on with the medication they've given their children.
And Pfizer's also testing a pill that could help ward off the virus. Can you give us a sense of how much of a game changer that would be?
So it would be an added part of the arsenal to fight this. So it's an antiviral combination drug. It's in trials now at Pfizer. Basically, it interrupts the sequence of viral replication. And really, this is exciting research. Even with vaccines, we know breakthrough infections can occur. Now, all that said, it's critical that we follow the science, we review the evidence. We've seen that again and again. So this medication is undergoing proper scientific review, and based on those findings, those peer-reviewed findings, we'll see if it's a medication that is beneficial for those with COVID. So we're hopeful, we'll keep watching it, and certainly if it does prove beneficial, it'll be a welcome addition.
It sure would be. Incredible to think we may get to a point where you can treat it with a pill. Dr. Ben Watson from Milwaukee tonight, we thank you for your time.
Thank you.